Today we're going to cover a very quick way to assess, and then more importantly, how we're going to treat patients with carpal tunnel syndrome. And I'm not going to go over the entire etiology and treatment. However, one key component that people gloss over that often don't address with their patients is nerve gliding and nerve flossing. And with carpal tunnel syndrome, it's one of those things that can really be a game changer in your practice. As far as looking at nerve flossing and nerve mobilization, you can look at books like Michael Shacklock and look at books with David Butler. But when it comes to carpal tunnel syndrome, it's fairly simple and straightforward. Obviously, as chiropractors and anyone doing manual therapy, obviously address the more proximal issues. If there's any kind of axonal irritation, whether it's chemical or mechanical at the cervical spine, that needs to be addressed. However, when it comes to the actual compression and irritation at the carpal tunnel, we have two modes of injury, and we test those with orthopedic tests. It could be a compressive issue. We're looking at positive Tinel signs. We're looking at manual compression tests where you're actually putting compression right over the wrist, and we're also looking at things such as Phelan's test, bringing the wrist in and compressing down for a couple seconds. If you're looking at more of a traction type carpal tunnel, that's where reverse Phelan is going to come into play. I have this great picture of my son sleeping, and it brings, I saw that when I walked in the room, and I thought to myself, it's odd how sleeping postures can affect these orthopedic conditions, and the same goes for your patients. If they're getting into that wrist flexion or hyperextension while they're sleeping, they can create these issues, often presenting as nocturnal pain when it's not necessarily a red flag, it's just simply a postural issue. So when I look at treatment of carpal tunnel, we really want to use these nerve flossing and nerve gliding techniques as adjunctive to our already manual therapy and manipulation, myofascial release, or traction, whatever it is you do in your practice. So when we go through the treatment for carpal tunnel, the main thing being a nerve floss, you're going to put a lot of tension on the carpal tunnel in the median nerve when you bring your wrist into extension and also extend your fingers. So that's the first thing I'm going to go over with my patients, is how to do that maneuver. And then obviously when we extend the elbow, we're going to also put a lot more tension on the median nerve. So as far as the actual exercise, I'm going to have the patient looking at their hand and then bringing their elbow down into extension, wrist into extension, and separating those fingers into abduction, bringing the arm further and further back into abduction until they feel a tug across their forearm. And then you can release that tension upon bringing the hand back up towards the face, and then once again down into flexion, releasing the tension from the top, and then putting the tension back on the top and cervical spine, laterally flexing. So in full speed, it's going to start off with the patient tensioning and coming down, and then when they come back up, they're going to laterally flex away and laterally flex toward and back. We can also do a nerve gliding exercise at the carpal tunnel with just gliding at the actual wrist. You're going to start with the patient with their thumb down, and they're going to come up, pointing their fingers towards you, and then going into a stop sign, and then as they flip it over, you're going to pull at the actual thumb, bringing it into abduction, and then coming back over. And this is a simple way to stretch out the median nerve, and they can do that from anywhere at their desk or have you. Now, some people think that nerves don't move a whole lot, and the simple fact is your nerve is just like a muscle or a ligament or a bone, is it moves in different positions. Take for example the ulnar nerve, is that the ulnar nerve, obviously going in the cubital tunnel, just from flexion to extension can migrate 5 millimeters superior or distal. So that's one of those things you want to take in consideration, is that you're actually getting movement within that nerve throughout that process. So not only should we move the muscles and ligaments, but make sure we don't forget about the nerves in the treatment of carpal tunnel syndrome.